Okay. Well, my name is B. Moorhead, and I'm the Director of Texas Impact. I appreciate the opportunity to testify. Texas Impact is an interfaith organization, and as you know, we are working in partnership with the state. We don't always look for you to spend additional funds. We're trying to leverage the resources of community and faith-based organizations, for instance, to improve eligibility access for people applying for benefits. But in the case of the Medicaid expansion, we are participants in the report with Methodist Healthcare Ministries. We strongly support extending Medicaid to low-income adults. There are so many reasons that have been brought up, and there's no reason to reiterate all of them. I'd like to focus just for a minute specifically on the issue of local taxpayers. That was a primary focus of this report. Local property taxpayers are paying $2.5 billion a year for piecemeal services delivered in an inefficient way to people who largely would be eligible for Medicaid under an extended program and who certainly are not now, or those local providers will be getting them into the program. I'm a local property taxpayer. I voted to provide more health care in Central Texas, so I voted to raise my own property taxes for the hospital district here. But if there's an opportunity for the state to draw federal funds to relieve some of that pressure on me, I will feel resentful if we don't take it, and I think a lot of other property taxpayers will as well. If the legislature's position is, even though there was a way we could have saved you that local property tax money and let your community do what it needed to do with it, we've decided it's better for you to keep providing inefficient piecemeal services, and we'd rather just not do it. It's going to make people feel like they're being ripped off. 200 United Methodist women were here earlier this week, and one of them was pretty head up about this after she talked to her legislator. She said that the legislative office said the federal government can't afford it, so basically we need to help them by not taking this money. She said, I'm not just a Texan, I'm an American, and those are American dollars, and I paid them, and I want them to come back to my community and take care of the people in my community the way Congress intends them to. We can answer all the questions you want about this. You've also got with you a page that answers a few commonly asked questions. I'm happy to answer questions. I think that local taxpayers deserve a serious answer to why the state doesn't want to give them this kind of relief when it's so easily available.